Is there an area of your daily life that causes you an excessive amount of anxiety? Do you feel like you're still being affected by past trauma? Are unreasonable fears about a future event keeping you stuck from moving forward? If so, then you may be interested in hearing more about an effective, evidence-based treatment called EMDR. EMDR stands for Eye Movement Desensitization and Reprocessing, and while that name may sound intimidating, one of the greatest benefits of EMDR is that it often works quickly and without having you relive all the painful details of past events. In fact, it's not uncommon for people to feel a sense of relief and increased optimism in just a few short sessions. Here's a brief overview of what an EMDR session looks like. To begin, an EMDR-trained therapist will create a target sequence plan centered around what you'd like to work on, whether it be past, present, or future-oriented. Since this topic is causing you stress, an underlying negative core belief will be identified. This may be something like, "I'm not safe," "I should have done something," or "I'm not good enough." Alternately, a more positive, adaptive belief on how you'd like to respond will be created. "I am safe. I did what I could. I am good enough and okay just as I am." The therapist will also provide you with a series of stabilization techniques to refer back to for relaxation if needed. With EMDR, you're always in control through the use of an established stop signal if desired. The power behind EMDR lies in the process of bilateral stimulation. Most often, this involves the use of eye movements, either through hand gestures or the use of a light bar. This technique mimics the eye movements experienced in the REM phase of sleep, which is known to have a restorative effect on the body. Through concentrating on the disturbing event, paired with a negative core belief, while engaging in the eye movements, the result is a desensitization of your emotional reaction. Common client responses are, "I feel lighter," and "it just doesn't seem as important anymore." Through the use of a rating system, the therapist will record changes to the client's distress level to measure the session's effectiveness, as well as strengthen the more positive, adaptive belief. This process helps the client to not only desensitize their reaction to stressful thoughts and experiences, but also to reprocess any traumatic information that has been stuck in the brain's neural networks. This process may be compared to defragmenting a computer hard drive by getting rid of any unnecessary files in order to free up resources. Finally, the EMDR clinician will ask the client to keep a diary of any additional dreams, insights, or memories that may occur over the course of therapy, and follow up by desensitizing any remnants of the disturbing event.
Hi, I'm Marci Wise, a trained EMDR therapist seeing clients in the Naples and Fort Myers, Florida areas. In counseling, we always say the only way past something is through it. And I see my job as a guide to help you get through it as quickly and easily as possible. And EMDR can help with that. Schedule an appointment today to find out if you're a good candidate for EMDR. Help and healing may be just one call away. I look forward to hearing from you.